Hello, everyone. This is John Eller with Davie County Government and County Administration. I'm your county manager, and today we have our next COVID update for you and some great presenters on the phone as part of our emergency operations team and our public health response and our partners at the school system. So you'll be hearing, as you always do, from those weekly updates. We're doing those bi-weekly now. To make sure that they're more pertinent for you, because some things haven't changed a lot week to week. But we do have our next update for you, and we'll get started with our lineup here shortly. But on behalf of the Davie County Board of Commissioners and Assistant Manager Robin West and myself, we welcome all of you to this call and thank all of our partners for just the great work they continue to do to help support our county through the COVID-19 pandemic, and as we get all kinds of new information from our federal partners and state partners, just working with the great folks that we have on this call and that we're proud to call our teammates as we forge ahead together. So with that, I'll go ahead and jump into our first update today, which is from our superintendent of Davie County Schools, Mr. Jeff Wallace, who I know has been a very busy man. So, Mr. Wallace, we appreciate your partnership and your leadership and look forward to giving us an update here today.
All right. Good afternoon, John. Thank you very much. And partnership seems to be a key word. I will tell you that people ask me how I'm getting through a lot of this, and I say I'm leaning in on people and leaning in on each other among our school staff, our community for sure, and John, you're always willing to listen and be open and help. And for sure that I think Melissa's on the call today. I want to personally thank her and Suzanne and that team. But school is open, folks, and I will tell you, I am extremely excited. I had almost an emotional moment last week or 2 weeks ago visiting school and seeing kids. It bothers me that we're in the situation we're in, having to wear a mask and social distance, checking temperatures daily. But I will tell you, the energy sure overrides any of those frustrations. But it's been wonderful to get school back open. I will say there have been plenty of bumps in the road, but for the most part, it's going very well. And the efforts and that's been are well worth it. Just so the folks will know, school did open on August 17th, and we opened according to the Governor Cooper's directive of starting in Plan B, which basically means that the buildings are about 50% capacity, and that allows us to social distance. And when you're dealing with less children and less people, more opportunities to social distance, keep regular hand washing, and to maintain wearing face masks, face coverings. I have visited our schools multiple times, and no doubt that we're doing all three of the 3 W's is what we've come to know those to be, and our staff is doing a great job with that. And I want to sincerely thank our parents as well, John, because they have really stepped up to help us to make this happen. Parents do a good job in sending the best that they have to school, but children are children, and they're gonna act like children. But the adults have really embraced this situation. Parents have embraced the situation, and our children are benefiting from that. We started off the year by really focusing on the social emotional piece of our children and making sure they're okay, reviewing how to get online with their devices and making sure that they understand how to walk in the hallways and different things. And our staff have been very creative with that, but it's been a tremendous start. Again, been some bumps in the road, and reported last week that we had 7 cases that we were aware of among our students. We quickly got that information out to our parents. And again, thank you to Suzanne and her staff for helping regarding making sure that's accurate. But folks, I want to make sure you understand too that although we have some cases, and we're going to have cases, if you want to, each week we have, and you got 6,100 kids, and then nearly 1,000 staff members that interact on our 12 different campuses a week, that there are going to be cases. But what I can sit here and humbly say and proudly say and cautiously say to you that these cases did not originate in our schools. And again, I thank you to the health department for their efforts in the contact tracing to make sure we're okay. Our lead nurse, Lori Dingler, speaks daily, multiple times, typically with Melissa Luann and Amy and Suzanne. So we're leaning in on each other. We're making things happen. We've got a lot to learn. And one thing that we have learned is one of the options that we provided parents this year was a virtual option. Davie County Schools virtual. And in case there are children that could not come to school or parents chose to enroll their students in virtual. And I will say that we did not find out that we were opening in Plan B until middle of July. And then school started a week earlier this year, which kind of squeezed us. But getting a new school open has its difficulties in a normal year. But this year was even more so, even more difficult. But again, we've made mistakes. We're working through those. And DCS Virtual is getting its footing now. And we're pleased with what we're seeing there. And again, thank you to everyone, particularly, again, the health department and parents and our children. Thank you for a wonderful attitude, a lot of energy in our schools, and excitement among our staff. And again, our staff are making this work, John, in community. So I want you to, if you see a teacher or anyone, please communicate with them. They're checking temperatures every day, checking forms every day to make sure parents and kids are safe. Our nurses are doing a phenomenal job. Can't say enough about them. And I just direct everyone to our website for up-to-date information. And you're always welcome to call us, and if we can help. And John, that concludes my thoughts for today.
Thank you, Ms. Wallace. And we appreciate, again, your leadership and your team's leadership. And I know so many parents and families have been impacted by this and trying to figure out how to best help their child, whether it's online learning or whether it's trying to figure out work and getting their child to school. But, you know, if you see our teachers, thank them. Thank their assistants, thank all the school staff. It's not an easy job right now, and we do value them very much. So thank you, Mr. Wallace, for that update. We'll move on now to our Health and Human Services update. I think we have Ms. Melissa Spry with us here, who's our nursing director at our Public Health Division of Davie County Health and Human Services. Ms. Spry, thank you for what you're doing and what your team's doing, and look forward to your update here.
Thank you, Mr. Eller. I just want to say thank you for everybody for allowing us to report and talk with you today. I am representing Suzanne Wright today, the HHS director. So with that, I'll get started. With the active cases, overall today we have 505 cases in Davie County. We have 32 active cases. 1 case is still hospitalized, and we've had 9 deaths up to date. The age groups that continue to be the highest is the 25 to 49-year-olds. The second in place is the 50 to 64-year-olds. And then the 65 and up continues to have the lowest number. And of course, most likely those are the higher risk group, one of the higher risk groups, and they're taking hopefully extra precaution because of their age and their health issues that they may have. With that said, I'd like to just reiterate with Mr. Wallace, we really appreciate all the help that we've had from the school nurses, working with the staff and working with parents and families. They are a wonderful team. They are doing a great job. The nurses are on top of everything. And of course, we do speak with them several times a day throughout the week during school days. So I would like to also say that the cases that we have had in the school, I'd just like for people to understand that those cases did not get sick from being in the school. They had some exposure outside of school. And then, of course, they didn't realize they were sick, and then, of course, school started. But those cases that we've dealt with in the past week or two have not become sick in the school. The school is doing a great job with keeping the social distancing. Kids are doing a great job with keeping their mask on, and parents are doing a great job with calling the health department if they have concerns, or calling the school nurses if they have concerns with their child being sick. So the community is doing a great job all together, so we really appreciate all that. And that's why we just encourage parents and the children to continue the 3 W's as we always hear. wait the 6 feet, wear your mask, and wash your hands frequently. Hopefully, doing these 3 things outside of school and out in the community, we can prevent others from getting sick within the school. So I just like to say thank you, a great job at the school system. There is some new information coming out with the long-term care facilities. Long-term care facilities have received some guidance from CMS this week, and there is a secretarial order number 2, which requires nursing homes to test all staff at least every other week. With the CMS guidance that has came out this week, nursing homes, if they are, depending on their priority, if they're low, medium, or high risk, will determine whether they need to do further frequency of testing. And our long-term care facilities with Davie County, it's not the facility itself, but it's based on the positivity rate of the county. And with ours, they will begin testing twice a week in the long-term care facilities. And so that's new guidance from CMS that just was released this week as well. And so that will be something that will, the long-term care facilities will be managing and reporting any cases to the health department there again. One of the other new things that is on the horizon is they're talking about the vaccine. There are several different vendors that are working on the vaccine release. And of course, they're still, anticipating that may be October or November. The date's still up in the air. The federal government and the state locals are still trying to determine the priority groups for those that will be receiving the vaccine when it is initially released. So that is still yet to come. That information is still waiting for further approval and guidance. So just keep that in mind that, we will have plans in place and trying to vaccinate those priority groups here at the health department, and they may be different sites throughout the county when that is released and when we have vaccine determine how much we are approved to receive. So I just wanted to give a few updates this week with new information. And there again, thank you everybody doing such a great job and helping us and supporting us here at the county as well, at the health department. And that concludes my information for today. Thank you.
Thank you, Melissa. We know how hard you and Luann and the other team members there are working, and we appreciate all that you do. We know how busy you are and how many people you're trying to get back to and provide consultation to. And so like others on the call, we very much appreciate you. So please send our regards to the team, and thanks for being with us today. We'll now transition into our update from our sheriff, Mr. J.D. Hartman. Sheriff, what updates you have for us today?
Oh, good afternoon, everyone. Just I know that the governor has released some new orders or changed some restrictions in general yesterday. Those will not affect law enforcement per se, so just you can check with the governor's office for those new updates of 2.5, as he's calling it. The administrative office of the courts, however, has not changed any of their guidelines. So if you come to the courthouse to conduct any business with the clerk, probation officers, etc., those rules will still apply that are in place. You'll have to wear a mask, limited access, etc. So I would highly recommend you call before you come to the clerk's office and make appointments with them. If you're coming to court, come when your attorneys tell you to come. They are assigning times and either morning or afternoon sessions now. The other thing that we are doing, we have reopened the detention center as far as processing people slowly in a limited capacity to move back toward the normal operations at the detention center. That's really all I have, Mr. Eller.
Thank you, Sheriff. We appreciate how hard you and your deputies and detention staff work to try to mitigate this stuff, but also keep us safe. I know y'all aren't thanked half as much as you need to be, and we're very appreciative of you and thankful for you. So thank you for your partnership, Sheriff.
Yes, sir.
We'll now transition into our chief of our EMS crews, Mr. Joseph Ashburn here. He's going to talk to us a little bit about some emergency services updates, and we appreciate you being with us, Mr. Ashburn. The floor is yours.
Thank you, Mr. Eller. I was wanting to come up and give a report for Brian. Today, we're 176 days into the state of emergency. I want to go through and give a shout out to our partners from the state, federal partners and all for the support that they're giving us as far as resources and helping us with some of our responses. This week, I want to give an appreciation out to the Office of Emergency Medical Services and to the North Carolina Emergency Management for the partnership. They're a vital part of our operations in this state of emergency. They're providing us with supplies, equipment that we need to keep all of our EMS and fire marshals personnel safe. With the fire marshal's office and emergency services, our call volumes are steadily increasing. We're going through and transporting more people with some of the symptoms as they're changing. But so far, we've had to have a few EMS personnel tested, but all the tests have come back negative. We're taking all kinds of precautions to go through and keep everyone safe during the pandemic with different PPEs, disinfectants, and cleaning our equipment and everything before and after each call. We are going through and starting some training back to the public with the executive order being put out and opening up more space for the indoor occupancy. We're going to be doing a Stop the Bleed training, which goes along with a grant that we was able to receive from emergency management. If you go to the county website, towards the bottom of it, you'll actually see where you can register for the Stop the Bleed training. There is 3 dates in there. It's going to be September 16th, 23rd, and 30th. Like I said, these are open to the public. Once you go through and finish up the training, we actually have a Stop the Bleed kit that we was able to get from the grant. And this gives us an opportunity not only to talk about CPR stuff, but actually how to stop the bleed. So that's fulfilling an obligation from emergency management. The other thing I was wanting to throw out there was the community response team in a partnership with the health department and along with the sheriff's department. This program is aimed more towards our opiate overdoses right now. So if EMS runs a opiate or overdose that's involving opioids, then we'll get a referral from EMS, and we've actually got a meeting with Davie Medical Center to get referrals from them, and we'll have a crew to go out consisting of a community paramedic and one from the health department that's going to be able to go through and help give resources out during all this, because we've noticed, especially during this, we're seeing an increase in overdoses. So that's all I have on the update from EMS.
Thank you, Mr. Ashburn. We appreciate you and all the crews out there working to keep us safe on the emergency services side of the house as well. So we'll transition now and move on to our communications 911 update from Director Mr. Rodney Pierce. Rodney?
Thank you, Mr. Eller. Just to remind citizens, as the governor has put out his new phasing program, for any questions regarding these programs or guidelines, we're referring all callers to the state information system at 211. For any localized questions, contact the health department hotlines that should be displayed in this. As we still continue to screen callers for symptoms regarding COVID-19, so please be patient with our call taking process. These questions, again, are just designed to further assist responders as they go out and serve the community. And that's really the biggest updates we have from the 911 Center. Thank you, Mr. Eller.
Thank you, Mr. Pierce. We appreciate that. As you heard the sheriff mentioned earlier, the governor's order, most recent order came out recently, and it did change some things. And I wanted to just go through some quick bullets there before we conclude our call today. The mass gathering limits were increased to 25 people indoors and 50 people outdoors from the current limit of 10 indoors and 25 outdoors. Playgrounds are now open, which impact a lot of recreation and parks related programs and community centers as well. Also, related to recreation and parks, a lot of programming has now been revisited. Some fitness things include gyms and indoor exercise facilities are now allowing the ability to meet with certain restrictions in place, and certain types of programming, physical activity can also take place now. So please refer to the governor's order on that to get all the clarification that you need, or feel free to call the Raleigh office if you have any questions there. As always, every week we remind our citizens to be able to get any questions submitted to us. We're looking for themes or things that you want us to talk more about. What you have on the screen is the link where you can get that information to us. So we encourage you to do that, and we'll revisit that every few weeks. So with that, we'll conclude our time for today. We want to thank our citizens for their prayers and support. Ours are going back out to you, and I appreciate the we thinking that we all have and trying to get through this thing together each day and every week. So with that, thanks Davie County for tuning in to us, and we'll see you next time.